go ahead and get started since Dave's on.
Okay.
So introductions. Let's see, we have Sharon and Kevin and Randy and David and Mark Neary with Mason County, and we have the Mason Webb, we have Jean Bray and Carrie Davidson. Anybody else I miss? Can you see anybody else?
Ian Tracy, Environmental Health.
Oh, okay. I did say Ian, but there's somebody connecting now, but I'm not sure who it is. Oh, okay, Darren. Good. Okay, so I'd like to call the Mason County Board of Health meeting, May 24th, 2022. It is 3:04. Can I get an approval of the agenda?
So moved.
I'll second.
Okay, any discussion? Hearing none, all those in favor?
Aye.
Right.
Any opposed? Okay, we'll move on to the minutes. I'm hoping that everyone had a chance to go over the minutes. Can I get
to
them?
approve?
Second.
Any discussion? Hearing none, all those in favor?
Aye.
Aye.
Any opposed? Okay, so Dave, you're up with the ES or E2S HB.
Right. So 11:52. So we went through this last board meeting. It did go to the county. So, and how this is set up is, and surprisingly, just yesterday, the State Board of Health came out with their guidelines to do all this. So,
Okay.
yeah, so Johnny on the spot. It's going to add some wrinkles, but really they're very small and they're just kind of administrative. So, but we're good to go with this. So the way we're set up right now is we have 3 elected members of the Mason County Commission. We have 1 elected member of the Shelton Commission. We have openings for Squaxin Tribe, opening for Skokomish Tribe. Those are all required. Those categories are required. Now we have 3 other categories, and the way I wrote the code is we have broad categories, and then by motion, we're going to slot people into those categories. That way we don't have to redo this every time. We don't have to redo the code every time somebody changes their place on the board. So we have 3 categories. We have representative of public health, healthcare facility providers. So basically health folks. And we have consumers of public health, and then community stakeholders. So community stakeholders, I think we can think of those as Carrie and Gary. So we've got the schools and fire would be represented there. On the public health, healthcare facilities and providers, we have Peggy and Darren would fit in that category, which just leaves us the consumers of public health, and we don't have anybody for that particular category. So what we would have to do is then go through the recruiting process using just the standard form that I sent out with the packet. If someone's interested in being on the Board of Health, we put out an announcement, and then the Board of Health reviews that, and then the county commissioners approve it. So,
aren't we all consumers of health?
not by the,
Hopefully.
I mean, I say that half jokingly, but it's true.
it's true, but the state has some definitions that went with that. And so consumers, they're talking about people who are shelters, underserved communities is primarily what they're looking for. So once we get 2 people into that category, then we can add others to the other 3, but things have to be divisible by 3 before you can add anything in. So you have to have somebody in each category. So if we've got 2 in each of 2 categories, we have to add 2 to the 3rd category before we add to the previous ones. So
Gotcha.
So we're pretty good with the way the ordinance is written. Just small administrative things to make it match with what State Board of Health, it's not Department of Health, State Board of Health came out with their rulemaking in the WAC. Just small things. So we're pretty much ahead of the game and ready to go for July. We have to have this done by July because if we do not have an approved Board of Health by July 1st, any decisions made by the Board of Health post that date are invalid until we have a fully formed and compliant Board of Health. So
what you'd like to see is for us to move this on to the commissioners.
yeah, well, actually, no, you guys can actually do this. So
Okay.
what you would do is you have a motion to put Peggy and Darren into community stakeholders, into the public health, Carrie and Gary into community stakeholders, and to fill the consumers of public health through the recruitment process. That would essentially be the motion.
So moved.
Okay, here a second?
I'll second it, but I got a question, Dave. You also mentioned the tribes. Do they have,
Yeah, so the tribes are, those two positions will be filled through the American Indian Health Commission. So they will select two people from the tribes to represent Squaxin and Skokomish.
okay, then I second.
Okay. Any other discussion? Here, how about you, Kevin? Any discussion? No? Okay, hearing none. All those in favor?
Aye.
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 Any opposed? Okay, hearing no opposition, passes.
Okay,
Okay. So that's good. Health officers report. Is Carrie Gardner here?
she is in Europe.
Oh, okay.
No, I was just texting her just a few minutes ago. She said it's after midnight. She's going to bed.
Okay, so
So
do you have anything for her report or did
I
she?
do. So we did talk about COVID, obviously. I mean, it's a big thing out there. Right now, what we're seeing is an increase. So we went from 24.4 cases per 100,000, and we're now up to 172 cases per 100,000 in 7 days. And that is really undercounted because that's just the PCR tests that people are getting and are going through, excuse me, the normal lab process and getting entered into the Washington Disease Registry System. What it doesn't take into account is all the people who are taking the home test or antigen testing, and that's not getting counted in the system. So I think we're shy, probably by about a factor of 6.
Well, considering everywhere you go, they're handing out the home kits. I mean,
Right.
Right.
I mean, went to the senior center and they got a big stack of it at the senior center out there and they're handing them out like candy.
Yeah, there's just a lot of disease out in the community right now. And that was kind of our big point. In fact, in this building, we've had enough people who very recently have gotten sick that we put everybody back in masks in this building just to try to tamp it down for a week, maybe 2 weeks, and get a disease cycle under us and get it cleared out. But there's just a lot out in the community we're seeing. I mean, there's people out everywhere. This particular version, which is BA2, is about 40% more transmissive than Omicron was. So it is really kind of getting it past the other protections that we've had in place. And people are actually not winding up at the hospital, and our death rate has flatlined at 0, which is good. So that piece has been good, but our hospitalization rates are positive, but the amount of people that are sick is pretty high out there. So she was just passing along that, be careful, watch what you do in social gatherings, wear a mask if you're uncomfortable. And the other thing was, if you are symptomatic, you have a 5-day window to get in to get a Paxlovid or remdesivir, which can really improve your symptoms, but you got to do it in 5 days. And one of the problems we're having is that people, from the time they're symptomatic to the time they're testing positive, has been about 3 days. So by the time you take your test, you only have 2 days left to get into your doctor to get the therapeutics and have them be effective. So what we're trying to pass on to people is if you become symptomatic and you test positive, get into your doctor right away. we're trying to do an end around with that across the state with other health officers in contracting with a third party provider to do telehealth, telemedicine. So all a person would have to do is just show their test. The doctor runs through all their medications to make sure there's no drug interaction problems, runs through their conditions to make sure there's no contraindications. And then they're able to get a prescription that they can take to Fred Meyer or Safeway or one of the pharmacies that does have the medications on hand. And they can get it within 10, 15 minutes without having to get into to see their provider. So what we're working on now is how do we pay for that? So, the drugs are free, but how do you pay for the service? So we hope to see something out in the next couple of weeks to get people in through telemed to shorten the time frame to get them within that 5-day time frame. So it's going to be really important for them to do that.
So this is not something run through the healthcare providers or the hospitals.
No. So for example, the hospital does have this as well. In fact, I got Paxlovid through the COVID center, but by the time I was able to get in, I was like on the last appointment of the last day when it would be effective for me. So and part of it, the problem is if they get a PCR and it takes a day or two to come back, it shortens their window up even tighter. So the COVID clinic is actually doing that. I think Peninsula Community Health Services is also getting that out, but we're looking for a way for other people to get in there without having to try to make an appointment.
Well, if they have a good rapport with their doctor, if they test positive at home, I think a lot of doctors are going to say, okay, I'll phone it in.
Yeah.
And I've had a couple that way. I
Right.
suggest anybody that say they test positive to call their doctor.
Yeah, absolutely. And
I think their doctor would rather have them call them than go in and
Yeah.
spread it.
I think so. And I can tell you from experience that I started taking it on Monday, and by Thursday I was testing negative. So it cleaned things up very quickly, and I felt so much better. I was pretty sick.
Yeah. Okay.
Those are the big things from Dr. Gardner.
Okay. So then.
No
on to your-
monkeypox, Dave?
No, okay.
Monkeypox.
Come on, we need a new challenge, Dave. We had killer bees, and swarm hornets, and COVID, and now monkeypox, right?
And don't forget, Grant County got goat flu. So, but
And pretty soon rabies will probably be coming through.
right. So monkeypox did hit the news this week, and in the United States we have one case. In Europe, I think they have 90 cases out. I should say there's 90 cases outside of Africa where it's endemic. So they're watching what's going on, and the one case that's in the United States is in Massachusetts. It looks very much like smallpox, but smallpox is pretty much gone from the world, so that's not usually a consideration. But it is not a fun thing to get, but the chances of getting it are very low. I mean, just really, really low.
Yeah, it's not very contagious.
There was a comment on the news about the origin of this one coming from a giant, we'll just call it a fun party in a specific island where a lot of very wealthy people went for this specific event. Have you heard anything about that?
Yeah, so it sounds like they're still doing the epi on it, but it sounds like and there was an event attended by about 80,000 people, very close quarters. And that's what you have to be. You have to be very close to someone to pass this stuff along. So
and it was adult entertainment, which is how this spreads also.
Right. So we're watching the CDC obviously is keeping us updated as that comes along. And we have sent out already a notice to providers on what to watch for, what the symptoms are, those sorts of things. So we already have the information going out to our local providers.
Okay. So anything on your report, David?
Yeah, so I'd like to run folks, if I may really quickly, through the county health rankings, which just came out. And I'll just kind of run everybody through. I'm going to share my screen and let's see if this works. Actually, I don't. There we go. Share screen. And Okay, can you see the screen that shows the county health rankings?
Yes.
Okay, so when you look at county health rankings and you see here Mason County, the top line there below Mason County says health outcomes were in not the bottom quartile, we're one up from that. They used to show us, individually ranked, and you can find that data. We're individually ranked at 22nd in the state in health outcomes, and that takes a little explaining. So health outcomes, as you scroll down, is length of life and quality of life. So premature death is measured in years lost on a 75-year-old breakpoint. So if you die at 55, that's 20 years life lost. And they count all those up for the county over the course of a year, and it came out to 7,000. On the other side of that doesn't get explained is that if you die at 95, they don't credit us 20 years. It's just a cutoff at 75. So, and I can tell you from doing death certificates, we have a lot of people who really live to old ages. I regularly see 90s and even hundreds. So it's not exactly the best indicator, but it's the indicator that they use. Quality of life is pretty much self-reported. So take all the quality of life pieces with a grain of salt. And it comes through BRFST, which is the Behavioral Risk Factor Surveillance System, and which is done by phone, through phone interviews on quality of life. As you go down, health factors, it shows us in the least healthy and bottom quartile. And that's based a lot on some things that these measurements can change over the years. They're not measuring the same thing year after year, which would give us good tracking. Sometimes they change the standards of what they're measuring, or they change what they measure. So for example, it's good if you look at Perry County, it lists them as having no recreational opportunities. In a county that has hunting and fishing, and they've got a 150-mile bike trail, but it doesn't have a gym, like a commercial gym, so it has no recreational opportunities. It just depends on how they measure these things, and it takes a little bit of interpretation. There are some things that do jump out. Smoking, adult obesity. So if you roll adult obesity and overweight together, we're at well over 60% of our population is obese or overweight. So that is going to be a focus for us. This does give us a place to quantitatively make some gap analysis and update our community health needs assessment and start to allocate funds based on some of the things that we know are pretty accurate. So obesity, smoking, those things we can jump on and start working. And on a good note, we're actually going to be getting money this summer for enough to add at least 3 people to work on just this topic, the chronic disease piece. So some of it we may contract out, based on some of these things we're looking at. It might be wise for us, for example, on adult smoking to look at smoking in schools. And in the past, I've contracted with the American Lung Association to do that training in the schools, very cost effective, and that might be something we look at. So there's a practical application to the county health rankings. As you go down through excessive drinking, alcohol impaired, sexually transmitted diseases, which, and it shows that it's our sexually transmitted infections are going up, but we're below the state, but worse than the top US performers. So as you kind of extend out to the right-hand side, going down into clinical care, you look at primary care physicians, and it shows us as 4,100 to 1, where the standard, the gold standard is 1,000 to 1. But they don't take into account the way the geography works, and we have a lot of physicians in Olympia, a lot of physicians in Kitsap County, and we have people who are referred or transitioned back and forth between those. So it doesn't take into account the normal treatment patterns that happen in a community. So we had the same problem in Stevens County. A lot of our people went to Spokane. It was the main hub where all those specialty clinics were. So it tended to look worse than what it really is. So again, there's a lot of interpretation that goes into this data. You come down into social and economic factors. This is pretty hard data. This stuff is pretty easy to come up with. A lot of it comes through like OFM, places like that. Very easy to double check. This is pretty good data in here. Physical environment, as I said, we talked about earlier, driving along to work, long commutes, and we are what's called a micropolitan county. So we're not a metropolitan county like a Thurston or a Kitsap. We're a micropolitan, which means that more than 25% of our population travels to a metropolitan area to work each day and comes back. So that's what you see in the driving along to work and long commute statistics, is that population that goes to Bremerton, our population that goes to Olympia, works and then comes home, is counted into the physical environment piece. As you get over onto a place like the east side, where people tend to work in the communities where they live, that's much less. So one of the nice things you can do with this is you can really dig down into and make comparisons. And I was talking with Terry the other day about, making comparisons. So you can come up here, compare counties, and we're going to add from Washington, because there was some kind of misinformation out there on how we compared with other counties. So let's just pick Grays Harbor. And it puts our two side by side. So you're able to compare fair, poor health, all these health factors across the board. So you see adult smoking, we're just, even with Grays Harbor. Obesity, even with Grays Harbor. So you can start taking away some assumptions that rural counties tend to look alike. Go figure, and the more affluent counties, you could pull up San Juan and compare it here and find out that San Juan, under social and economic factors, looks amazing. They have average personal income of like 117,000, and they're surrounded by a 20-mile moat. Tends to if you're going to live in San Juan, you better be healthy. So it allows you to start making some comparisons that might actually mean something when you start putting these things side by side. So I just encourage the public to go to county health rankings, dig into them, and then think about what they mean. If you have questions, get a hold of us. We can answer questions about what the county health rankings mean, and then what kind of actions we can take from that. So as a board of health, as county commissioners, as the health officer and I look at these things, and we have a new community health manager, Melissa Casey, and the three of us are going through the county health rankings. We're going through the community health needs assessment and doing a gap analysis. So what are the things we really need to work on? And some of those things that we've been working on, so they've come to the top of what we want to work on: chronic disease, obesity, diabetes, those things that we know kill us, behavioral health, and then substance abuse and alcohol. So, we have an article that we're reading about this week about alcohol deaths, and how alcohol deaths are actually higher than our COVID deaths. So, what factors play into those alcohol-related deaths during the pandemic? So this is great data. It's something we use in our work. Like I said, you take it with a grain of salt and use it as appropriate. But it is a good resource, and it's something they do come out with each year. So it's what we use. And are there questions on the county health rankings?
Dave, I want to say thank you for showing me this. This is really helpful. I appreciated the conversation we had the other day, and knowing where I can go out and take a look at this is very helpful. So thank you.
Yeah, I think I might get on with Jeff Slakey and put this out online and just do it like a data with Dave. I've done this before, and people have really appreciated being able to find data for themselves and make their own judgments without public health telling them what the data means. Let people find data for themselves and make their own interpretations.
Okay. Any other questions for Dave on that? Okay, so Ian, I didn't see a environmental health report in the packet, but do you have something you want to share with us?
Yeah, good afternoon, everyone. I just wanted to, if you don't mind, I'd like to share my screen for a moment, just give you an update on some shellfish growing areas.
Yeah, I'm gonna see if I can get out of it here, Ian. Yeah, come on, go full screen. Kind of stuck here. Hold on a second.
Ian, I'm going to a fundraiser at Taylor Shellfish tonight, so tell me good news on shellfish, please.
Yeah, you should be fine. We have plenty of open areas right now, but there is somewhat of a downgrade in Oakland Bay, unfortunately, which is a problem area.
A second here. I'm not getting my thing at the bottom of my screen is gone.
There's often a thing at the top, Dave, the very top that says like stop sharing. Do you see that?
I'm not seeing it. I had to expand my screen. Hold on a second. Okay, I'm just gonna pop off for a second. I'll pop back on. That'll be easiest.
Sounds good.
Maybe. Or not. Come on.
You're not allowed to leave, Dave.
Not allowed to leave. That is really, really strange. It went to like a minute. There we go.
There you
There we
go.
go.
There we
All
go.
right.
All right. Now I'm off. Okay. Mackenzie probably saved my bacon on that.
All right. Does everyone see the map? So this is Oakland Bay. The north end of Oakland Bay up here has two conditional areas. So usually both of these conditional areas are closed if there's greater than 1 inch of rainfall. That's been a conditional closure for a long time. The reason why there's two conditional areas is because this more northern end, the one closer to Deer Creek and Cranberry Creek, they are typically closed if there's greater than 1 inch of rainfall, and they're closed in the summer months. So unfortunately, water quality data has continued to fall, and it started to affect this other conditional area farther out from the two creeks. And now the additional condition of being closed in the summer has been tacked onto this section. So now both of these conditional areas have the same condition of greater than 1 inch of rainfall closed, and then closed in the summer months. So it's not technically a downgrade in that it doesn't count against us for a number of acres of shellfish growing area open, but it is a reduction in the portion of the year that these areas can be harvested. So it's not a good thing in general. But on a positive note, we now have our Oakland Bay, our Mason County Shellfish Protection District funding available to start spending, and we'll probably begin doing our ambient monitoring and doing investigative work in June coming up here. So hopefully we'll be able to find some pollution sources up in those drainages up there and get some positive direction on the shellfish growing areas up there and get some reopenings occurring. Other than that, that's all I've got for you. Any questions?
Okay. Hearing none. So I think the next one is community health report, and that should be Melissa, I believe.
And Melissa is out ill today, so
Oh, great.
it's been going through the crew pretty hard.
It's been going through everything, and it's not necessarily COVID. So.
No, there's a couple of things going around. Yeah.
Yeah. So I know She sent out quite a report. Does anybody have any questions that maybe Dave could answer? Okay. Hearing none, how about other business? Any other business for the board? Public comment. I noticed you're on the meeting. Jean, do you have any comments?
Oh, hello, everybody. I'm not going to put my photo up, but I had just wondered about the infant formula crises. I don't know if David, I hate to put you on the spot,
No.
but I'm just curious about these things.
So what we haven't really been involved with that in kind of roundabout way. So WIC in many cases has been a lot of the provider here in Mason County. What we've had though, Gene, is that WIC is no longer in South Mason County. So in North Mason County, they're still servicing clients up there. In South Mason County, a lot of our clients are going to Olympia for service, and not very convenient. We're looking to eventually bring that back. And part of the WIC program is that dietary piece, and then getting with dietitians on children with special healthcare needs that would need that infant formula. If WIC comes back in, we'll get involved in that piece again. But as far as the supply chain goes, we really don't have a piece of that.
And I
Oh, all
think,
right. Well,
I think WIC in North Mason is still supplying, although I know it was a little hard to get the formula. But I haven't heard that they haven't been able to.
I see. I was just really, really curious how that all comes together and works. You know, I've got a grandchild on the way, and one has outgrown his formula. And it's just that, you know, as a matter of fact, like I heard this ABC News report earlier in the week that they would distribute the very first infant formula they got from abroad to medical providers. And actually, it seems like there's a lot of milk allergy that runs in my family, for instance. And so my children were raised in West Virginia, but my mom in Bellevue had the goat's milk already in the refrigerator because QFC sold goat's milk 32 years ago when the baby was born. And so she had tried goat's milk with me, and that worked for her. So she had goat's milk in the refrigerator when I got here from Dulles Airport 31.5 years ago with the baby. And then also, just for what it's worth, well, I guess that some doctor's offices, you know, are distributed the formulas. And so I had my baby on a soy formula that a relative worked as an LPN at a doctor's office and gave us the formula that way. So I was just really curious about the current issue. Excuse me, not to keep your time.
Thank you, Jean. Randy, do you have your hand up?
I do not that I know of.
Oh, it's on my screen, but it's just probably something weird with my computer.
Okay.
Any other comments? Okay, hearing none, can I get a motion to adjourn?
So moved.
Second.
Okay, all those in favor?
Aye.
Aye.
Okay, see you in 2 months.
Okay.
Have a good one.